Hello, everyone. Today, we'd be discussing a couple of questions that we had in February, March 2025, and the possible answers that we could have on those questions. Now, these questions that I'm talking about are from paper three A2 psychology. And as you'd all be aware, if you talk about paper three or paper four, for the matter of fact, if you talk about A2 psychology, there are four different components that the CIE offers you. And out of those four components, you're expected to study any two and then answer your questions in the Cambridge examination, the CI, on those two components that you've studied. So the four components, I'm sure you all do know. The first one being clinical psychology, the second one being consumer psychology, the third one being health psychology, and the fourth one organizational psychology. So out of those four components, the first component, that is clinical psychology, we'd be discussing questions that we had in the February March 2025 paper on cognitive psychology. Now, it is always important. I'd strongly advise that you all understand your paper structure. Not only do you understand your paper structure, I think it makes a lot of sense if you know what your paper would be like. If you already have an idea as to how your paper would be like or what sort of questions would you have, it is, I believe, a plus point, and it makes you feel more confident and less anxious when you have the actual paper in front of you. So the first question, most of you would be aware, puts you through a situation. So they're putting you through a situation, and based on your knowledge, based on the psychological knowledge that you've gained the entire year, you'd have to apply that knowledge, right? So one, it is pretty essential that you have that knowledge. It's super essential you have that knowledge. Number two, it's equally important, equally essential that you know how to apply that knowledge, right? I'm sorry. So the question over here is, Rahul has obsessive compulsive disorder. We're talking about this gentleman with the name Rahul. Rahul has obsessive compulsive disorder and he constantly worries about his family's safety. So we're talking about this gentleman with the name Rahul who has obsessive compulsive disorder, and this gentleman constantly worries about his family's safety. So you'd all be aware, you should be, that when you talk about OCD has the obsessive component there and has the compulsive component there. Where the obsessive component are your intrusive, reoccurring thoughts, those reoccurring thoughts that keep on bothering you. Whereas when we talk about compulsions, your compulsions are, you use the word compulsions when you're acting to neutralize those obsessive thoughts. So we're talking about this gentleman with the name Rahul. Rahul constantly worries about his family's safety, right? So Rahul constantly worries about his family's safety, and this constant worry that this sorry so this constant worry that this gentleman Rahul carries, he these are his obsessions, right? So note that part. One, to reduce these worries, see, now we're moving on towards him acting in a particular manner to be able to neutralize those obsessive thoughts, right? So to reduce these worries, he arranges his books by color, newspapers in date order, and food in his okay. So food in his kitchen cupboards alphabetically. So how does this gentleman act to be able to neutralize his thoughts? He arranges his books by color, one. He puts his newspapers in date order and the food in the kitchen cupboards alphabetically. Now, the question some of you might have at this point is, oh, what do these obsessions have to do with the way he's acting now? You do not necessarily, your obsessions and your compulsions, they do not necessarily have to go hand in hand. They're usually, I mean, it's not necessary that they're aligned. For instance, if I may give you an example over here, if you talk about someone who fears germ contamination, right? If there's someone who fears germ contamination and that particular individual has obsessive, dangerous thoughts that keep on bothering him, and to neutralize those thoughts, to get over with those thoughts, if that gentleman starts washing his hands, now this makes sense. Someone who fears germ contamination starts washing his hands repeatedly, which would make him feel safer. However, there are certain instances where your obsessions, that is your reoccurring thoughts, do not really align with your compulsion. So this is a case like that. To reduce these worries, he arranges his books by order, newspapers in date order, and food in the kitchen cupboards alphabetically. If any of items are placed out of sequence, Rahul becomes very anxious and immediately puts them back in order. So if there's anything that he finds that this gentleman Rahul finds to be out of sequence, he gets very anxious. I'm sure you all do know when you talk about OCD, that is obsessive compulsive disorder. Obsessive compulsive disorder is an example of anxiety disorders. So the umbrella term over here is anxiety disorder. And under the umbrella term of anxiety disorder, OCD is one of such disorders. So if there is anything that is out of sequence, this gentleman Rahul, he'd start feeling anxious, and he would immediately put everything back in order so that he feels safe, so that he does not have to risk his family safety. Now, taking this side, I understand. I'm sure I'd like to assume you're understanding it by it now as well, that the obsessions and compulsions did not going in line, did not aligned. Now, quickly moving on to the question, I try not to take very long today. Suggest how cognitive behavioral therapy could treat Rahul's OCD. See, your knowledge, your psychological knowledge, your knowledge on this unit, obsessive compulsive disorder, is essential. Remember when I said that. But at the same time, it is very important that you know how to apply that knowledge, right? Now, they're asking you for a suggestion. And of course, if they're asking you for a suggestion, there's no definite answer to this. Anything that makes sense, anything that uh, that helps with using cognitive behavioral therapy to be able to treat this gentleman Rahul, if it is aligned with the syllabus, you get your marks there. So I think let me read the answer that we have over here, and then I'll explain you why I think this answer should get a 4 on 4. So the first part, cognitive behavioral therapy could help Rahul by challenging his irrational beliefs that order prevents harm to his family. Now, I think I did not explain what cognitive behavioral therapy is. Uh, I wouldn't take very long again. Now, when we talk about cognitive behavioral therapy, as the name suggests, your cognitions. So it's a therapy, it's a cognitive therapy, right? Based on the idea that you identify those irrational thoughts that an individual has, right? So we're talking about those irrational thoughts that an individual has. Those irrational thoughts would be identified, and then those irrational thoughts that have been identified now would be challenged with the help of a therapist, right? So cognitive behavioral therapy, that is cognitive behavioral therapy, the idea is change an individual's irrational cognitions or thoughts, and the behavior would change. Cognitive behavioral therapy could help Rahul by challenging his irrational beliefs. It's, of course, an irrational belief when this gentleman feels if things such as his books, the newspaper, or food from the kitchen, if they're not in sequence, his family's safety would be at risk. It is irrational. So it is pretty important that you help Mr. Rahul understand. First, help him understand that he's wrong. Help him identify where he's going wrong. So cognitive behavioral therapy could help Rahul by challenging. The key word over here is challenging. You're challenging what? You're challenging, you're helping him challenge his irrational beliefs that order prevents harm to the family. One, a therapist could identify this faulty reasoning and replace it with more rational thoughts. So, a therapist over here is expected to help Rahul identify his irrational thoughts and change them, or replace them, or rectify them into something that's more rational, something that makes more sense. So, a therapist could identify this faulty reasoning and replace it with more rational thoughts, such as understanding that his family safety is not linked to the arrangement of household items. I feel by this tiny little paragraph that is of 3 lines, it wouldn't really be tiny when you'd be writing it down in your paper, because this is typed, it doesn't look like it's enough. But of course, if you take a screenshot over here and try writing it down on a notepad, you'd see that this is enough. So I think the first mark, you'd get the first mark because you are able to identify the cognitive aspect over here. So the cognitive aspect has been identified in this first paragraph, and that is how you're getting the first mark. And number two, you'd get the second mark because you're able to explain the cognitive technique behind it, right? So, one, the cognitive aspect, you identified where things were going wrong. Number two, you almost suggested a technique to it, right? So you're partially there. This is how I feel you'd get the first mark, and this is how I feel you'd get the second mark. Moving on to the third one now. The behavioral part of CBT would use exposure and response prevention. So if you have studied well, if you know your unit obsessive compulsive disorders well, you know what this is. ERP, that is exposure and response prevention. So if you have a look at the book, there's this example study to it as well. The behavioral part of CBT would use exposure and response prevention. So what is exposure and response prevention? As the name again suggests, you expose your patient, let's call Rahul a patient over here, you expose the patient to whatever the object is, whatever the thing is that triggers his anxiousness, right? So over here, what we know is what triggers Rahul's anxiousness is things not being put in sequence, things not being in sequence. So the behavioral part of CBT would use exposure and response prevention. Moving on, Rahul could be ERP. So exposure and response prevention. So not only do you expose, but at the same time you prevent the response to it. What is the likely response that Rahul has? The likely response that Rahul has is him immediately putting things back in order. So you mess up things maybe and then not allow Rahul to put them back in order. This is what we're talking about. Rahul could be generally exposed to disorder in his surroundings, such as mixing up books or food items, and be encouraged not to rearrange them. Over time, he would learn to tolerate the anxiety without performing the compulsions, leading to a reduction in obsessive thoughts and compulsive behavior. So, the third mark is where you have identified the behavioral aspect. Over here, you had identified the cognitive aspect in the first paragraph. Number two, in the second paragraph, now you have you have mentioned the behavioral aspect to it, right? And the fourth mark, you'd get the fourth mark when you write down about how the ERP technique could actually be used in Rahul's situation to be able to help him treat, to be able to treat him with his OCD. So this is how I feel you should not lose any marks if you write anything that is maybe structured in this particular manner. So see, remind yourself, question number one. Question number one would put you through a situation. Be mentally prepared, go mentally prepared. And then you'd get a question which would be a 4-mark question where you'd be expected to walk out of that situation. And that's possible when you are well prepared, you know your content from the syllabus, and at the same time you know you have the right skill to be able to apply that knowledge. So it's a 4-mark question, 4 solid things that you think can help you get through would actually help you get through. So this question, because this says suggest any answer, could be a very good answer as long as it is covering what it should be covering. So I think I took a lot of time with that first question alone. I did not intend to at all. Let's move on to the second question now. If you have a look at the second question, outline what is meant by determinism. Now, about the second question, you have issues and debates that are part of your syllabus. A few such as the nature versus nurture debate, individual versus situational explanation, free will versus determinism, reductionism versus holism, idiographic and homothetic approach. So you need to know that the second question would test your knowledge on those issues and debates. Nowhere does your syllabus say that it would be that your paper would be like this, but if you have a look at the few past papers that we've had, you see that this is what is actually happening. So go a little mentally prepared. Outline what is meant by determinism. Fair, easy. So determinism versus free will. You should know this, including not a discussion, including an example from the psychodynamic explanation of fear related disorders. There you go. Your knowledge on the unit anxiety, what I do. So, your knowledge from the unit anxiety and fear disorders should be there. Alongside that, you should be good with the explanations over explanations for anxiety and fear related disorders. And being more specific, you should be uh, good with the psychodynamic explanation that was put forward by Freud. So it's a 2-mark question. For this 2-mark question, you are asked to outline what is determinism. That is very simple. That is something that would give you the first mark. So you simply define determinism and you get your first mark. You get the second mark for exemplifying that through the psychodynamic explanation. Let's see if this is easy peasy. Determinism is the idea that human behavior is controlled by internal or external forces rather than being chosen freely. So, this is what secures the first mark for you. Moving on to the second mark, for example, Freud argued that phobias are caused by unconscious conflicts between the id and ego. Remember, uh, the psychodynamic explanation to anxiety and fear related disorders, or the psychodynamic explanation in general. Remember personality structures, remember the id, the ego, the superego. So over here we're talking about, I mean, I could explain that, but it's going to take us very long, and I think I've already taken a lot of time, so I try to quickly get through this part. There are 2 more questions I need to cater to as well. So for example, Freud argued that phobias are caused by unconscious conflicts. If you know the psychodynamic perspective, you know what this is, between the id and ego, such as in the case of little Hans, whose fear of horses symbolized deeper unresolved feelings towards his fathers. So if you know the unit, if you know the unit anxiety and fear related disorders, if you know the psychodynamic explanation, you exactly know what we're what this part that I've highlighted over here in green is referring to. So, why I'm doing this? I'm doing this to remind you all that just learning through the syllabus is not always enough. You need to know how to answer your paper. You need to know, you need to learn how to attempt your paper. And if you've just learned content and not learned how to attempt a paper, that isn't really a good thing. So yeah, if you have time, you might as well put that time to the right use. So for example, Freud argued that phobias are caused by unconscious conflicts between the id and the ego. And then I'm explaining it. See, if you know it, you might as well write it in the paper. Why not? Such as the case of little Hans, whose fear of horses symbolized deeper unresolved feelings towards his father. Now, Oedipus complex is what we're talking about over here. Why is it that I have written the such as part? Because I did not want to lose a mark. So for you, if you are there uh, attempting your paper in the CAIE, if you know it, you might as well write it. Remember, there's no negative marking in the CIs. I mean, don't just go about writing whatever from wherever. If it makes sense, if you think by adding a line to your answer would help you secure that 1 mark, get it. Now, moving on to the second part from question number 2. Remember, 4 questions, right? 4 questions in clinical psychology. Question 1, question 2, question 3, question 4. Question 1 is of 4 marks. Question 2 is of 4 marks, right? Question 3 is of 6 marks. Question 4 is of 16 marks. So this is how it goes. 4, 4, 6, 16. Do the math, it would turn out to be 30. So 30 marks from clinical psychology and 30 marks from whatever the second component is that you've studied. In my case, I teach health psychology. So 30 marks from clinical psychology is what we're discussing today. And then another 30 marks you'd have to secure from health psychology. Now, taking this ahead, question number 2B. So this 4-mark question is divided into 2 parts. The first part is of 2 marks and second part is again of 2 marks. Explain one problem psychologists may have when investigating the psychodynamic explanation of fear related disorders. So, one problem that psychologists might have when they are investigating the psychodynamic explanation of fear related disorders. You see, not only do you need to know not only do you need to know the psychodynamic explanation, you also need to know it according to the anxiety and fear related disorder unit. Because remember, the psychodynamic explanation is used in two units. If you talk about your syllabus, it is used in the unit anxiety and fear related disorders, and it is also used in the unit obsessive and compulsive disorders. So quickly moving on, a problem is that psychodynamic explanation of fear related disorders involves unconscious conflicts. So, if you know the psychodynamic explanation, you get this. Such as, now, why is it that I keep on writing, for example, why is it that I keep on writing such as, I'm securing that 1 mark? I'm making sure that I'm showing the examiner that I know what I'm talking about, right? So, uh, a problem is that the psychodynamic explanation of fear related disorders involves unconscious conflicts, such as those between the id and the ego. Since these unconscious processes, example, the castration anxiety in little Hans, which if you've studied a little Hans, you know what this is, cannot be directly observed or measured. Now, question yourself, if you know this, the castration anxiety that this young boy had, do you think it could have been directly observed? No. It's it's the thoughts that this child would be carrying, right? The anxiousness that this little boy would be carrying, which again cannot be directly observed. It again cannot be directly measured. So based on this theory, so if you're someone who believes in the psychodynamic explanation, you'd be believing in the problems that arise because of unconscious conflicts. Now the question that rises over here is, how is it that you're going to directly observe them? How is it that you're going to directly measure them? Moving on, it is difficult for psychologists. Now you're getting to the point. You're getting to the point. You're actually answering the question. So it is difficult for psychologists to scientifically investigate. Let me put this in a box as well. It is difficult for psychologists to scientifically investigate the cause of phobias as suggested by the psychodynamic approach. So Freud very conveniently, or the psychodynamic model or the explanation or the approach very conveniently talks about how these unconscious conflicts that have not been resolved when young could lead to problems ahead. The question is, how is it that you're going to objectively measure them? How is it that you're going to objectively observe them or directly observe them? Or what about scientific testing? It cannot be done. You cannot directly figure out someone's unconscious you cannot directly figure out someone's unconscious conflicts. Now done with question number 2 as well, which was a 4 mark question. I believe what we have over here should help us get a 2 on 2, and what we have over here should also help us get a 2 on 2. Now, why is it that the second part, the first part I've already explained, why is it that the second part I feel should help us get a 2 on 2? Because number one, you identified the problem. You not only identified the problem from the psychodynamic approach, but you also, or the psychodynamic explanation, but you also linked that identification process with fear related disorders. That's how you get the first mark. The second mark, when you explained the issue, where you very clearly contextualized it, when you put things into context. Okay, so this is what they believe in, but specifically talking about little Hans case, you gave an example. You made a point. You made sure that the examiner does not have a chance or opportunity to not give you this mark. Learn how to do that. Put your pen to paper, practice, and you do good. Moving on to the third question here. So the third question, which is a 6 mark question, like I said, 4 marks over here and 2 marks over here, 4 and 2 together makes 6. This question again over here has to do with this lady with the name Isha. Isha has generalized anxiety disorder, and her clinician wants to monitor her during therapy. So there's a lady with the name Isha. She has generalized anxiety disorder, GAD, and she has a clinician who wants to monitor her during her therapy. So what I understand from here is Isha is probably diagnosed with generalized anxiety disorder. That is why this says she has generalized anxiety disorder. She goes to see a clinician who is treating her. That means Isha is going through a therapy, and the clinician wants to monitor the progress. So this is what I've picked on from this one line. See, read it once, read it twice, read it thrice. I've seen many students complain, oh, we don't have enough time. Trust me, you do have enough time. Question yourself, did you practice enough before you went for the before you stepped into the examination hall? See, wishing full marks, desiring full marks is amazing, but making that wish come true, you'd have to put in efforts accordingly. You need to know what the examiner demands. You need to know how to write to be able to score full marks. And the point again was, do we have enough time? I believe yes, you do have enough time in your CIs, provided you have practice beforehand and you know the amount of time. See, the amount of time that I take to write would be different from the amount of time you take to write. So everyone is different. Everyone is uniquely amazing. You need to identify what your strengths are. You need to identify your weaknesses or the things that you're not very good at, and then work to improve that, work towards making it better. So moving on, suggest how generalized anxiety disorder assessment could be used. Okay, so we're talking about GAD-7. Suggest how the generalized anxiety disorder assessment GAD-7 could be used to monitor Isha during and after her therapy. So Isha is being treated. Her clinician wants to monitor the progress. She is using, no, she wants to use, let's assume she wants to use generalized anxiety disorder or the GAD-7 scale, and so that she could be used to monitor Isha during and after therapy. Okay. Now, another important thing that I'd want, like I was just saying a minute earlier, read your question, read it over and over again, once, twice, thrice. And I'd say, even when you're writing an answer, midway writing through the answer, read your question. Because if you're doing that, you're ensuring that you're keeping the reader, in this case, the reader now would be the examiner, the paper checker, you're keeping that reader engaged. So you're actually answering a question. So there are two things. So during the therapy, her progress needs to be monitored, and after the therapy. Fine, makes sense. Taking this ahead, the generalized anxiety disorder 7, the GAD-7, could be used by Isha's clinician to measure how often she experiences symptoms such as feeling nervous or restless during the therapy. Now, feeling nervous or restless during the therapy. How did I know this? I'd only know this if I know what GAD-7 is. When you have that knowledge, you might as well put that knowledge to use, right? So the GAD-7 could be used by Isha's clinician to measure how often she experiences symptoms. So you can measure how often she experiences symptoms, and then you've told what the symptoms are. Many students, I'd see many students write it this way. The GAD-7 could be used by Isha's clinicians to measure how often she experiences symptoms. Remember when I said a couple of minutes earlier, such as, for example, things like this, you secure your marks. You do not let go of your marks easily. So by repeating the GAD-7 at a regular interval, example, weekly or monthly, the clinician can track whether her anxiety scores decrease over time, which would indicate improvement. Now, see, you're explaining it all. You are actually contextualizing it. You are actually solving an issue that Isha's clinician has, and you're helping Isha or the clinician, right? So you know what situation it is, and then you're answering accordingly. Taking this ahead, yeah, this monitoring helps the clinician decide if the therapy is working or whether changes need to be made. Fair enough. After therapy, the GAD-7 can still be used to check for any returns of symptoms, helping to prevent a relapse. Now, what are we talking about? How is it that we could get how is it that we could get 4 marks over here? If we talk about this particular question, for a question of this sort, if we have a look at the marking schemes from the past, it says you get 1 to 2 mark for basic description, and if you very clearly apply the monitoring process, if you very clearly explain, contextualize, and then explain how whatever you're suggesting is going to help Isha and her clinician, that is how you'd get full marks. So the GAD-7 could be used by Isha's clinicians to measure how often she experiences symptoms such as feeling nervous or restless during therapy. One, by repeating the GAD-7 at regular intervals, right? Like uh, if you have fever, your temperature might be checked by a clinician or a nurse or your parent or your parent at regular intervals, right? So likewise, in this case, if Isha is someone who has generalized anxiety disorder, what could be done is the GAD-7 could be used at regular intervals, example, weekly or monthly. This can help the clinician keep a track whether her anxiety scores decrease over time. So you have quantitative data now. You could very easily compare if Isha's anxiousness or generalized anxiety disorder symptoms are reducing or not reducing, which would indicate improvement. This monitoring helps the clinician decide if the therapy is working or whether changes need to be made. So if the therapy is working well enough, if the therapy is not working, then you need to come up with plan B. So yeah, after the therapy part, now this part, the GAD-7 can still be used to check for any returns of symptoms, helping to prevent a relapse. Moving on quickly to the second part of question number 3. Explain one weakness of GAD-7. So GAD-7, we all know it's a self-report measure. You all should know. One weakness is that the GAD-7 is a self-report measure. So you get the first mark for identifying the weakness. How is it that you get the second mark? This means Isha might underreport or exaggerate her symptoms, either intentionally or unintentionally, reducing the accuracy of the assessment. So when you talk about self-report measures rely on the information. They rely on the information that you receive from the patient or whoever the person is who's providing information to you. So if they're honest, well and good. But if they're not honest, that would reduce the accuracy of whatever you're trying to figure out. And in this case, this lady Isha, if she underreports or exaggerates her symptoms, she could do that intentionally or unintentionally, which would reduce the accuracy of the assessment. Moving on. So we're done with 3 questions. We now hopping on to the fourth question. So question number 1, like I said, was of 4 marks, 4 marks. Question number 1, expect a situation there. Question number 2, expect issues and debates. Question number 3 is a 6-mark question where again you see how your knowledge is now being tested, and along with the knowledge, your application skills, how good you are at applying, right? I mean, imagine this question could have simply been about the uses of GAD-7. No, the examiner chose to come up with Isha's case over here so that the examiner could test if you're actually able to apply the knowledge that you've had. And I hope you all are aware about the assessment objectives I keep on mentioning in my classes, but assessment objectives, I just take this opportunity to quickly write them down for paper 3. So for paper 3, your assessment objective number 1, that is knowledge understanding, is of 26 marks. And so yeah, this is of 26 marks. If I talk about AO2, this is also of 26 marks. And AO3 is of 26 and 26, we left with 48. This is of 48 marks. Not marks, I'm sorry, this is percentage, my bad. So it's 26, 26, and 48. This is the percent here. So this would make it 100%. So this is how your paper is made. Just in case if you've forgotten what AO1 is, AO1 is, what color do I choose? So AO1 is your knowledge and understanding. AO2 is your application. Okay. And AO3 is your analysis and evaluation analysis, or analysis and evaluation, right? So this is how your paper is made. So what I'm talking about is it's not just your knowledge. It's not only about learning it from the book. You need to be able to apply it as well. So this is how your paper 3 is made. Your paper 3's assessment objectives are, that's how your paper is set, and that is how your paper is set and your marking is done. If I talk about overall, the overall assessment objective or the overall weightage, how do you spell this? So yeah, the overall weightage over here for AO1, for A2s, yeah. For A2s, this is 30%, and AO2 is 35%, and AO3 is 35%. Whatever I'm saying over here, please go back, open up your syllabus. This is overall A2 psych, okay? Go back, open up your syllabus, and you'd see all of this there. So why is it that I just wrote this? One, to remind you if you've forgotten. Number two, to reiterate on the significance of acquiring application skills along with evaluative and analysis skills that we would talk about in a bit. Acha, see if this is 26%, 26%, 48%, 100% makes it in total. Remember your papers of 60 marks. And right now I'm just dealing with, we just be discussing 30 marks from the component clinical psychology. So let's quickly move on and deal with question number 4. Question number 4 is of 16 marks. If I talk about question number 4, question number 4 is divided into two parts. The A part, that is the description part, is of 6 marks, and the second part, that is the B part, that is evaluation question, where your evaluation and analysis skills are tested, is of 10 marks. So together 6 and 10 makes it 16. Having a look at this question, describe the biochemical dopamine hypothesis explanation and the psychological cognitive explanation of schizophrenia. Okay. Now, this requires a bit of clarity. I'd like to take this opportunity. I keep on saying this in classes very often. In fact, it's more like a ritual when I open up the syllabus any before every lesson to show you where we stand. And I keep on saying you need to know your syllabus well. See, your syllabus has, if you open up the syllabus, it's simple. Go to Google, write down A-level psychology 999-2025 syllabus, and you'd come across that PDF. You all have internet. If you're watching this, you have internet. You might as well just pause this here, go open the syllabus. If you've opened up your syllabus, you'd see, go to the clinical psychology section there, and you'd see the clinical psychology section is divided into 30 bullets. So the entire component is divided into 5 different units, that is 5 different chapters: schizophrenia, mood affective disorders, impulse control disorders, anxiety and fear related disorders, and OCD, right? So there are bullets there. So within every unit that is a chapter, there are sections. And within those sections, you'd see tiny bullets there. Count those bullets, there are 13 total, right? If there's anything that is mentioned in the syllabus, you can get a question on it. As simple as it could be. Couldn't get clearer. If there's anything at all mentioned in the syllabus, you can get a question on that. Why is that I'm saying this? I'm saying this because, yes, I think I feel uh, the example studies more the key study. Key studies are super important. Example studies are important too. That both your key studies and example studies, they cover quite a lot of your syllabus, but they don't cover all of your syllabus. For instance, this just occurred to me. If I talk about GAD-7, or if we talk about psychometric measures, GAD-7, or if we talk about the KSAS, kleptomania symptom assessment scale, they're psychometric measures. They are not an example study, nor are they a key study, but they're there in the syllabus. If they're there in the syllabus, you could get a question on it. So the likelihood of you getting a question on key studies is there. The likelihood of you getting question on example studies is there. That's there because they're a part of that bullet. That's there because, more so, that's there because that's there in the paper because it's there mentioned in the syllabus. So describe the biochemical explanation, biochemical being specific, the examiner's been specific here, dopamine hypothesis explanation and the psychological, that is cognitive explanation of schizophrenia. Now, yeah, so there's no example study here. There's no key study. Yes, there's a reference study that was conducted by Frith et al. You could get a question of this sort. I mean, you have a question of this sort, so you might as well get it again. So whatever's there in the syllabus, you should know it well. And when I say write answers to descriptive questions, that's the first step. That's the first step. You know, when you hold a baby's hand and make the baby walk, that's that first step. So that's where you begin. That's where you take a start from. You acquire that skill. And another reason behind me pushing students on descriptive question is because that's the basic. If you don't know, if you don't have that knowledge, how is it that you're going to apply it? Or for the matter of fact, how is it that you're going to evaluate it? That's the first thing you have to do, which is again important. So describe the biochemical dopamine hypothesis explanation and the psychological cognitive explanation of schizophrenia. So this particular question, number 4, we see is from the unit schizophrenia. We see that this is from the, let's scan it in ahead. It's from the first unit schizophrenia. It is from the second section, that is explanations of schizophrenia. And the examiner has been a little too specific here. From the biological explanations, the examiner has missed on the genetic part and asked us about the biochemical or dopamine hypothesis. So today I was asked by a question by a student if you should write about the genetic part. I mean, I wouldn't, because the examiner hasn't asked. The examiner has been super clear when the examiner says describe the biochemical explanation. The examiner did not say describe the biological explanation. The question, read the question, understand what the question says. And the examiner couldn't have been any more clear when the examiner writes describe the biochemical dopamine hypothesis explanation. So you exactly know what to do. And the psychological explanation, you exactly know what to do, provided you know the content there. So I'd simply keep 3 marks for this. 3 marks for this. I know this is a 6-mark question, easy calculation. For a 6-mark question, I wouldn't want to give anything more than 9 minutes to this. Nothing more than 9 minutes. So at this point, if you think you cannot write a detailed answer in 9 minutes, shorten that up, rephrase it, learn it better. Yes, many students in the quest of wanting to hit a 6 on 6 over here end up not being able to finish their paper. Bitter truth, know it when you can do something about it. So you might as well open up your notebook and attempt a paper. Attempt a paper so that you know how long you're taking. Scoring full marks on this question, getting a 6 on 6 over here, since this is the first component, that is question number 4, and then not being able to finish up the last evaluative question from the second component. In our case, it would be health psychology. I don't think it's a very good deal, because if you're losing marks, because if you're pushing yourself to get full marks over here and then not being able to finish the last question, which is of 10 marks, of course, losing 10 marks is not wise. So you should all know, and like I had said a couple of minutes earlier, everyone knows their limits, everyone knows their strengths. So your strengths would be different from mine. You could be someone who writes fast, I could be someone who does not write fast, or the other way around. So let's take this ahead. Describe the biochemical dopamine hypothesis explanation and the psychological cognitive explanation of schizophrenia. The biochemical explanation of schizophrenia is known as the dopamine hypothesis. Okay. It suggests that. So for this, it's if you know it, you know it. This answer has been written from your book, the Cambridge endorsed book, the purple book, as many students refer to it as, and the author is Julia Russell's. So this is from there. If you know it, you know it. You don't know it, open up the book and you'd see this information there. What I wanted to remind you was, I mean, more than the answer, I wanted you to know how, I wanted you to go check how long you're taking. I wanted you to know if there are two things specified, make sure that you're giving both of them equal importance, equal significance. And for this particular question, there's since it's a 6 mark question, you get marks over here on the basis of okay. So you get marks over here on the basis of there are different levels on the basis of which you get marks. And once we're done reading this, we'd see if this I mean, I feel this does fulfill the requirement for a top level answer. You'd be a better judge too. So the biochemical explanation of schizophrenia is known as the dopamine hypothesis. It suggests that people with schizophrenia produce too much dopamine or have too many dopamine receptors. This leads to, now if you read your book, you know where all of this is from, and I deliberately did this so that you know it's about you knowing the content. There's nothing fancy that gets you full marks. So this leads to neurons firing too often or sending too much information, especially in areas like the Broca's region, which can result in symptoms such as disorganized speech. Supporting evidence includes drug trials. Substances like L-Dopa or amphetamines increase dopamine and can trigger or worsen hallucinations and delusions. PET scans and postmortem studies have also shown increased dopamine activity in brain areas such as the striatum and limbic system in patients with schizophrenia. This is exactly from your book. I mean, you can rephrase it, you can reorder it. What is the criteria from the Cambridge? Question number one. And are we fulfilling the criteria? Question number two. So let's read the second paragraph. That would be about the cognitive explanation. The cognitive explanation suggests that schizophrenia results from faulty mental processes. Frith in 2015 argued that it involves abnormal self monitoring, where people fail to recognize their inner speech as their own, causing auditory hallucinations. Delusions may occur when patients logically try to make sense of these hallucinations, wrongly attributing them to outside sources. Frith also suggests that negative symptoms like reduced speech and social withdrawals are linked to impaired theory of mind, which makes it hard to understand the intentions of others or initiate spontaneous action. I can explain the entire thing to you, but I believe it has already been an hour, if I'm not mistaken, more or less an hour, and I don't want to spend more of time on this. Uh, so yeah, this is if we have a look at the criteria that the Cambridge has, what is it that the Cambridge expects from us to from an answer which is level 3, that is level 3 is you getting 5 or 6 marks. So the Cambridge expects you to clearly address, open up any marking scheme, right? So where is it that I'm giving this information from? Open up any marking scheme for paper 3. I believe it's on the second or third page. It would say table, I believe it's table A, if I'm not mistaken. Just open it. It would either be table A or B. Just open it and you'd see this over there. It very clearly mentions that this is how the examiner would give you marks on a descriptive question. So if you're clearly addressing the requirements of the question, must cover both theories or concepts if two are required. So this is what we're talking about, because there are two that are required over here, right? So you're clearly addressing the requirement of the question. The requirement of the question, the command word over here was describe. Yes, we described. Okay. Must cover both theories or concepts if two required. One. Number two, description is accurate and detailed. Of course, this is accurate. This is from the book. So you need to rely on your memory. I don't have to go sit for a paper. You do. You see if you can reproduce the same information, the same content while having your book closed. So description is accurate. Oh, yes, it is accurate. And it is detailed. This one is detailed too. The use of psychological terminology is accurate and appropriate. Yes, check, 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 check. All of these psychological terminologies, they're accurate and they're pretty appropriate. You should be able to demonstrate an excellent understanding of the material. Of course, with all this description, this does demonstrate, I believe, at least I feel this demonstrates excellent understanding of the material. Now, did we do this? That was a requirement from Cambridge. Now the question is, did we do this, or did this answer do that? I think it does cover both theories in detail. One. Number two, yes, accurate and appropriate psychological terminologies used, for instance, dopamine hypothesis, Broca's region, self-monitoring, theory of mind. Number three, this does demonstrate an excellent understanding of both the biological and cognitive explanation shown. So I feel this is a top level answer. So it's a 6 on 6, I feel. If you don't like it, maybe a 5 on 6. Nonetheless, it does cater to the requirements of a level 3 answer. Uh, One more thing, write an answer. See how much you can write in 9 minutes. Moving on to the B part, which is an evaluative question. So, an evaluative question where you are expected to evaluate the same uh, topic that you've already described in part A. This is a 10-mark question. And the command word over there was describe. Over here, the command word is evaluate. The rest part remains the same, more or less, minus the last part. Evaluate the biochemical, that is dopamine hypothesis explanation, and the psychological, that is cognitive explanation of schizophrenia. This part now, which is important, including a discussion about reductionism versus holism. There you go. Including a discussion about reductionism versus holism. A debate. You are expected to evaluate. You're expected to evaluate. No, the question hasn't finished yet. Evaluation in your answer can include strengths, weaknesses, and a discussion of issues and debates. Okay, we know that. Now, let's take this ahead. A 10-mark question. Know that you get 15 minutes here. Don't get carried away with this question because remember, there's another 30 marks that you need to cater to from another component as well. Keep that in mind. If we have a look at this question, how is it that you're marked on this or graded on this particular question? You're again graded or marked on the basis of different levels. Level number 5 is the top level here, where if you've hit level number 5, if you've met the criteria of level number 5, you'd either get 9 marks or 10 marks. So how is it that I would attempt this question? Number one, know that there's no specific what do students call it? No, there's no specific pattern that the CI has prescribed. There's no specific pattern from the CI. It's us teachers, we advise students to follow a particular pattern, or when we feel a particular pattern is more meaningful and could help us get more marks easily as compared to the others. So just know that there's no prescribed pattern from the CI. More so, I recall there's another 2 videos that I've put on evaluative questions. I believe, yes, I have, which would again give you a very good understanding on how to go about with evaluative questions, just in case if you're interested. Now, about this one, I would write an answer, an evaluative answer. See, I'm going well prepared. I know I have 15 minutes. I know what to do, what not to do. I'd start my answer with an introduction. Now, a frequently asked question over here is, do we get marks on introduction? No, we don't. Second possible question could be, if you're not getting marks, why are we writing one? Aesthetics. I would write one. If you think it makes sense to you, you might as well write one as well. That's the first paragraph. So like I said, I'd divide my answer into 5 paragraphs. The second paragraph, I'd want to write about the named issue. I'd like to evaluate in terms of the named issue. Now, this is the named issue, the thing that I've put over here in this box. The third and the fourth paragraph would be, again, evaluations on either any other strength, any other weakness, or any other issue or a debate. That's my call, right? So this part, the examiner tells us that this one part, the examiner tells us to use as an evaluation. The other 2, I bring it on my own. So why other 2? Why is it that I plan on using 3 evaluative, or using 3 things on the basis of which I'd evaluate? Because see, if you have a look at the marking scheme, it reads a good range of issues, including the named issue. A good range. If you're just writing the named issue, it's not a range. 1 is not a range. 2 could be a range, but it's not a good range. A good range, I believe, would be 3. So, and I've come across many credible people who think 3 is a better option. Rest, it's your call. So I'd start with the introduction. The second paragraph, the second paragraph would be about the named issue. The third and the fourth paragraph would be other issues or debates or strengths or weaknesses. And the fifth paragraph would be a strong conclusion. There should be a strong conclusion reflecting your analytical skills. Now, the introduction over here is two widely studied. I think the mic had gone off now. I'm not sure what part do you get from here and what part you don't. So, yeah, uh, if the mic did, yes, I see I remember, I just noticed the mic had gone off. Even in that case, I see it working right now, and you have the content over here. So might as well put this to use. Now, in terms of reductionism versus holism debate, the dopamine hypothesis is highly reductionist as it explains schizophrenia purely in terms of brain chemistry, especially dopamine levels and receptor activity. Now, we've mentioned the named issue over here. Not only have we mentioned the named issue, we are aligning it with the syllabus as well, with the content that we had described earlier as well. So, in terms of the reductionism versus holism debate, the dopamine hypothesis is highly reductionist as it explains schizophrenia purely in terms of brain chemistry. You know what reductionism is? When you're focusing on any one aspect, right? So, when you talk about the dopamine hypothesis, it focuses only on brain chemistry, specifically dopamine levels and receptor activity. While this approach is supported by scientific research such as drug studies and PET scans, it simplifies the disorder to just one biological factor, ignoring psychological and social aspects. In contrast, now over here, you've written the dopamine hypothesis part, and now you're starting off with the cognitive explanation. Now you'd be evaluating the cognitive explanation in terms of the reductionism versus holism debate. So in contrast, the cognitive explanation is more holistic. So we called the dopamine hypothesis reductionist, whereas we calling the cognitive explanation holistic. Fritz theory not only incorporates brain abnormalities, but also looks at how thinking errors, such as failure in self monitoring and theory of mind, can result in symptoms. This offers a more complete picture of the disorder by acknowledging multiple interacting factors. So, I mean, you could write more, but remember there are time limitations. One. Number two, the second debate that we've chosen over here is the nature versus nurture debate. Okay, I keep on asking students to not not jumble up things for the examiner. Keep it simple for the examiner. Keep it neat, something that pleases the eye. Use block paragraphs. What is a block paragraph? When you leave a line after paragraph, I understand you're under pressure. I understand you're sitting up for a paper. I understand you might be stressed. But if you're going well planned, you will be in a better position to spend those 90 minutes in the CI in the examination hall. So know these tiny little things what many students do is, I've seen many students, if nothing works, they try confusing the examiner. Don't do that. Don't do that. That's not helping you anyway. So you try keeping things in order. You write a paragraph, you leave a line, and then start another paragraph, which is a better way to go about. So the nature versus nurture debate is also relevant to both explanations. The dopamine hypothesis falls strongly on the nature side, as it assumes that schizophrenia results from biological abnormalities present in the individual, such as increased dopamine activity or genetic vulnerabilities. However, it overlooks the role of environmental triggers like stress or trauma. So, this part, when you're talking about the dopamine hypothesis, we're saying this falls on the nature side of the debate. And from this part to this part, right? Now, if we talk about the cognitive explanation, I'm not explaining this. I mean, I'd love to, but it has already taken a lot of time. The cognitive explanation, although grounded in internal mental processes, can incorporate nurture. It is grounded in internal mental processes. So nature versus nurture, remember, but it can incorporate nurture by acknowledging that experiences such as childhood interactions or stress environments can influence thought patterns and contribute to the development of schizophrenia. Thus, the cognitive model allows for a better interactionist perspective between nature and nurture. Number three, we talk about the free will versus determinism debate. In relation to the free will versus determinism debate, the dopamine hypothesis adopts a deterministic stance by suggesting that abnormal brain chemistry dictates behavior, leaving the individual with little control over their symptoms. This can be problematic as it implies that those with schizophrenia are not responsible for their actions. The dopamine part, the cognitive part now. The cognitive explanation also leans towards determinism in that it assumes that faulty thinking leads to symptoms. However, cognitive behavioral therapy is based on this model, promotes an element of free will, as it encourages patients to challenge and change their thought processes, empowering them to manage their conditions more effectively. So yeah, you might as well just pause this over here, read this, and hopefully you would understand it. I don't think there's any rocket science here. Probably you would. Moving on to the fifth paragraph, when we come concluding it. In conclusion, both the biochemical and cognitive explanation offer valuable insights into schizophrenia, but they differ in scope and implications. The dopamine hypothesis provides strong biological evidence, but is limited by its reductionist and deterministic nature. The cognitive approach is more holistic and flexible, considering both internal thoughts and external influences. Together, these explanations can be integrated to form a more comprehensive understanding of schizophrenia and guide effective treatment strategies. So yeah, I think this answer does meet the criteria. If you have a look at the criteria expects us to give a detailed evaluation or discussion of the key study or the psychological theories, research approaches, explanations, and treatment of therapies that are contextualized throughout. So you saw all of this was contextualized throughout. Analysis is evident throughout. A good range of issues, including the named issue. Selection of evidence is very thorough and effective. Must cover both theories or concepts if they're required. We tried doing that. If we move on, uh, we did cover the named issue. We did write down about reductionism versus holism, and we fully addressed that. There were two additional debates. That is, we use the nature versus nurture debate, and we use the free will versus determinism debate. And we tried clearly explaining them with direct links to both the theories. Yes, there was a strong structure, I feel so, and there was analysis throughout, and our evaluation was contextualized, and there was thorough evidence that we used according to the marking criteria that we come across in the paper. So yeah, this was a tiny little attempt by me to help you understand what could be done to help you score better. And yeah, I hope this has been helpful. Thank you.